In 1993, I got my 30-something motorcycle. On the way home, a truck with a brand new motorcycle, a truck pulled in front of me, a King Cab Dually. I slid under the truck, pretty much almost completely cut my lower leg off. They took me to the hospital in a helicopter. The doctors were going to cut my leg off. I convinced them to get me a second, third opinion, and finally, by signing a bunch of stuff and telling them I was a lawyer, and if they cut my leg off, they were going to be in trouble, they didn't cut my leg off. So, a couple years and $500,000 worth of surgery later, I had a leg, but fairly useless and a lot of pain. I had 13 broken bones in this accident, a broken pelvis. I have rods from my hip to my knee, from my knee to my ankle. I could walk, but mostly with a bad limp and with one foot at a 70-degree angle to one side. Lots of pain. When my pelvis was broken, it's like my butt was broken, and that caused me a lot of pain, actually more than my leg. I was taking Percocets, one a day at least, for 2 or 3 years, and I threw a tennis friend. Well, I played tennis. One of my best friends was top 100 in the world tennis player, so I was a sparring partner for him. And to get that good at tennis takes a lifetime, and here I am, can't play tennis, and that was almost one of the most important things to me. And I played in tournaments, and I teach tennis even today still. I'm back to teaching today. But and when I tell the doctors I play tennis, they go, well, tennis is not in your future, son. Living is in your future if you're lucky. But I lived in Florida when all this happened. I moved back to Ohio and ran into Sherry's husband, and who played tennis. And I went and hit a few tennis balls with him and couldn't run. And he said, well, my wife could help you. So reluctantly, I am, like I said, lawyer and engineer, reluctantly and with very much, I didn't think that anything she could do was going to help me. I'd been to all kinds of physical therapists. I certainly didn't think that anybody playing any sounds would help me. So in humoring her more than anything, here's the wife of my new tennis buddy, so in humoring her, I let her play some sounds. She guessed at what sounds I needed. I found the sounds pleasant. That I was a sailboat charter captain, and I was a tugboat captain, and I liked the sound of that droning engine that you barely hear, which her sounds resemble. They're like a whoa, 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 whoa. And I go, well, there are no needles involved, no pills involved, no pain involved in using this form of therapy. So what have I got to lose? And I like the sound. It helped me sleep. So as much as anything, I used it to go to sleep. Then I started noticing I was having less pain. Within a month or less, I was not taking Percocets, or only taking 2 a week instead of 8 or 9 a week. And I really hate taking even an aspirin. So getting off of those pills was good. And then by having that reduction in pain started allowing me to do more. I could run 2 steps that way, and then 3 steps that way, and then 5 steps that way. And after an hour of trying to play tennis, what would happen, when I approached Bill, I said, I'm good enough, I can hit the ball anywhere I want to hit it, any spin I want, but you got to somehow hit it back to me because I can't run and get it. So I'll run you all over the place, and you don't run me at all, is how we got to do this. So we did that. And of course, then I'd take a step, and I would have intense pain after tennis, and I noticed that I was having less and less pain, even though I was doing more and more. And this was about 1999, and it's now 2007, so this is 8 years ago. I met Sherry and started doing this. Well, within a year, I was in a no pain situation. Within 2 years, I was in a there's nothing wrong with me anymore situation, just learning to run again, and also realizing in tennis that I could run again, because I would let things go that I'd forgotten that I could run. And I used to dream that I could run, the dream like in the movies where people are slow motion running through the field. I'd have these dreams, and now I don't have those dreams anymore, even because I can run, so about all that's wrong with me now, even the form of my leg from the exercise, it was like a football, and you may see some pictures of it the way it was before, the way it is now. But the only thing wrong with me now is just what my leg looks like, and even the looks of it have vastly improved. I mean, I could get cosmetic surgery, but leave well enough alone, and I don't care. It's good for a shark bite story now and then. But
I had been to many centers, including Ohio State, Cleveland Clinic, Mayo Clinic, and there was a lot of disagreement on what was wrong with me. I remember a doctor at Cleveland Clinic thinking I had an autoimmune disease, and being an emergency physician, they would have to shut me down every so often since I'd be on very strong immunosuppressant drugs. These are drugs that suppress the immune system and set you up for infections, and the emergency department where I work is really ripe for infections, so they thought I would frequently have some problems with infections. They were going to put me on high-powered drugs to combat things. So it was pretty scary the way they were going. I first became ill late summer, early fall 2001. I noticed that there was a problem with me walking. I was falling. I lost the ability to run. I had tingling numbness in the bottom of my feet. I went to a local neurologist here, and he did quite a few tests, and they uncovered I had something called a syrinx. This is a disorder of the spinal cord, almost like an internal cavity where fluid from the inside pushes on pressure on the spinal cord and causes neurologic symptoms. And the treatment for it was neurosurgery, where they actually do a procedure where they open your vertebrae in the back, and they cut into your spinal cord and put a little device to let the fluid out. This was supposed to make me better. At that time, I was walking with a mild limp. This was like November of 2001. Over the next 4 to 5 months, I progressively got worse. I went from a slight limp to walking with a cane to using a wheeled walker, and then I was pretty much confined to a scooter. Despite the neurosurgical therapy I had such bad spasticity in my legs. I was on high-dose Valium, and also had an internal pump placed in my spinal cord, which administered a medicine to take care of the spasticity of my legs. My legs were so tight, it's hard to bend my legs at the hips and knees, almost impossible for me to get in and out of a car. I remember finishing a shift in the emergency department. The nurses would come by and actually help me get in my car and slowly wait for my legs to relax well enough I could just bend them to get into my vehicle and get home. I was driving with hand controls at the time, but just getting in and out of the car was a major undertaking, despite all the medications I were taking at that time. We weren't sure what was wrong. I went to see a neurologist at Ohio State. They had checked my spinal fluid, and based on what they saw in the spinal fluid, they thought I had primary progressive multiple sclerosis based on that. And they offered me chemotherapy for multiple sclerosis. The type of chemotherapy that you get is called Novantrone. It's toxic to your heart. You can only give it for 2 years. And then after that, there's no treatment left. Well, this didn't sound very endearing to me. I opted not to have that. I wanted another opinion. I subsequently went to the Cleveland Clinic, where they were not really sure what was wrong, thought I had some type of autoimmune disease. And again, I went for another opinion to the Mayo Clinic, and once again, there were a neurologist saying, well, you seem to have picked all these symptoms out from so many different possibilities, and just really wanted to start all over and repeat all the tests that I've had done. And I had already been through at least 15 MRI scans of my head, neck, body. I had complete CAT scans done, had all sorts of exotic blood work done, which really did not lead them one way or the other. So at that point, I remember the neurologist leaving me, shaking my hand, and telling me how sorry he was for me. And at that point, I knew I needed to do something different than other what current modern medicine could do for me, and so I started looking for other answers. At this point, I saw another local physician who recommended certain things. I did things such as acupuncture, all sorts of different types of medical treatment out there, and she also recommended bioacoustics. So there was actually a place in Ohio that offered such treatment. And at that point was my first visit with Sherry Edwards and Sound Health. And I believe this would have been towards the end of 2003, perhaps 2004, I'm not sure the exact year. And at this point I was looking pretty rough. I was getting around with a wheeled walker. I still remember going up to her place in the wintertime, trying to get up this hill to get through her door. I'm thinking, boy, maybe I should just turn around and go back home. But I'm glad I did. And she did spend a lot of time with me, did an assessment, and did something called a vocal print. And at that point, found some problems. Did not think it was multiple sclerosis. Thought it was more of a traumatic problem to my spinal cord, and had actually given me certain tones to use for this. And I've gone back subsequently now for the last few years, and happy to report I've gone from a person that was working part-time, barely making it through the day, to someone who is a full-time chairman of the department, sees more patients than any other of the 13 doctors that are here, off all medications, my internal spinal pump removed last year. I had them check my spinal fluid. Nothing to suggest any abnormalities, nothing to suggest any multiple sclerosis or anything like that. So I really doubt if I really had the disorder to begin with. Even more glad that I didn't take chemotherapy for it, for something I probably didn't have, and very grateful to what I have now. At this point, I walk with a cane. I still have stiffness in my legs, weakness, and some numbness, but it's nowhere near it was before. Pretty much have a normal active life. I can't run at this point, but I haven't closed the book on that yet, and I hope to be rid of the cane and be back to normal at some point. So just gotta have to continue to work with it. I use a tone box. I keep a tone box playing every night. I have it hooked up to a subwoofer. When I have a chance, I will attach it to headphones and listen to them, especially if I'm exercising. And I go back to see Sherry every few months, and we do another voice print, find some other things that might help out, and just tremendous benefit. And it works for other things as well. One of the things, my wife brought a cat into our life, a cat that she's had for years, which I was pretty strongly allergic to. Sneezing, head congestion, itchy eyes, coughing, wheezing. And I said, what can you do to help me? Well, she played the tones for cat allergy gone. Tremendously. So I think that's how I made my wife a believer, because she did not see me when I was impaired as badly as I was. And when she saw the change there, she was quite impressed at how well it worked.
A friend of mine told me about a lady called Sherry Edwards who was coming to Melbourne, Australia, and she could stop blood flowing with her voice. Well, I wasn't very interested. I just was a bit rude to him and just said, oh, really? And 3 months later she came back again because she'd started a training course. And I was still not interested, but I was bored, so I went along to hear this lady speak. And within the first 5 minutes of her lecture, she mentioned that she'd worked with heart and lungs and liver and macular degeneration, and she used all these common terms except for macular degeneration. Well, I went into shock because I'd just been told 2 weeks before I had it. I really knew I did have it because my optometrist told me, but I'd had it confirmed by a specialist, and he said, I suggest you pick up a hobby that doesn't require eyesight. And I dwelt with that for a few weeks and thought, I don't think I'm going to have to worry about that. So when this lady comes and mentions this very specific term, I thought, I've got to see her. So that was how I contacted Sherry. I did some training, then came out to the States to get the next bit of the training. And they worked on me, Shari worked on me at one of the visits with macular degen, because while you can be diagnosed with it, it doesn't necessarily interfere with your eyesight for a while. It can take years for it to manifest in affecting your eyesight. And at that stage I had about in our terms, a 20-cent coin size blank spot in my field of vision. So if I closed my good eye, there would be total whiteout for about that much on a page of writing. So she worked on me, trialled frequencies, and nothing happened. It was probably about the 10th sound or tone she was giving me. I suddenly saw lines of writing through that blank spot. I still couldn't read them, but I could see there were lines of writing. It was like, my God, there's lines of writing there now. Like within 10 seconds of hitting the right tone. And so her follow-up was to work on codons and genomes and decode them a couple of days later. And when she trialled those sounds on me, holes came in this blurry field where I could clearly see letters. Perhaps 3 or 4 letters spanned, and it just gradually improved that I could read again, listening to those sounds. And the other wonderful thing was I got colour back because some of the proteins she was working with, there's different proteins to help you see different colours. And I didn't realise till months later when I was at home looking at some parrots in the bush. We've got very colourful birds. I suddenly could see the very bright red head on a rosella. And I thought, oh my gosh, I haven't been able to see a colour at distance like that for a long, long while. So that was a lovely insight to get as well. And I've had some other great things with myself, with a huge reaction to an antibiotic. I was covered in a rash coming out all over me. And I had to get help with it. It was too severe for me not to get an antihistamine, which I did. And then a friend said to me, well, did you try your sound? And I said, no, I didn't. She said, well, come on, I want to see what you do. Show me. So I took my voice print and had a look, and the very highest in the voice print, the most out of range spike, would be the equivalent of a thing called leukotriene D4. Now they're the things in the body that cause inflammatory and allergic responses. And there it was, just totally showed up. And to work with that to bring it down, it was the frequency equivalent of an antihistamine. So I dialed it up and listened to it for 10 minutes, went to bed and the rash was 70% gone the next day. Listened to it twice more and it was totally gone. The doctor told me it could take weeks for that rash to fade, and it was still progressing through my body at the time I started listening to the tones. So that was a nice proof to me that the voice does reveal features that can be useful.
But Shari's work on sound, I've been following that in the 90s. I didn't decide to finally come and visit her until 1990, well, maybe the year 2000. But in 99, I had watched some of her work with gout. My wife happens to suffer with gout, and I wanted to see if that would help her. So we came down here, and I had an encounter with Shari, and she was much more than I expected. She had a very special gift in picking up people's problems without the aid of computers and all this other fancy technology that has evolved to sort of express what she innately can do. She has a condition called synesthesia. Many people probably are not familiar with the word. Synesthesia is a form of functioning where your senses are mixed. In the normal person, not she's not normal, she's super normal, but in a normal person, your sight and your hearing are separated. In synesthetics, senses are blended together. So for example, when she hears you talk, she sees colors and things of that sort. And so that gave her a unique way of perceiving what was happening with her. One of her earliest encounters with her gift was she was visiting for her own problem at a doctor's office, and there was a man who was being treated for hypertension, and when she heard him talking, she started humming a sound that brought down the blood pressure. So the doctor was so impressed that he had this repeated, and that's little by little, that's how she went off and tried to make sense of her talent. And as you know, her claim, well, not only a claim, because I think at this point it's fairly validated, is that the human voice is a hologram of the human body. So according to her perception, the frequencies that are missing from your voice is what your body needs in order to reestablish the balance that a normal, healthy body should have. Health, in a sense, could be defined as when you're not aware of your body at all. When you start becoming aware of your body, any part of your body, it's your body telling you where the problem is. One of the things that impressed my wife when she came down with me, I had a condition since my young years. I had a type of shaking that's called intentional tremor. It's controlled by the cerebellum. I was a war baby, and during the war, my mother obviously didn't have access to the right foods, and so I had certain deficiencies of vitamins and so forth that led to this. But as a teenager, it was very embarrassing. But let's say I wanted to dance with the girl, and my hands would be shaking. I felt very calm inside. But the girl would say, well, what's wrong with you? How come your hands are shaking, you know? And that, of course, would make me shake even more. And after a while, it sort of pushed me away from the whole idea of even dancing. Well, anyway, when I was in medical school, I remember when the professor used me as a guinea pig, trying to figure out what I had. At that time, Freudian concepts were very prevalent, so the students were projecting all sorts of Freudian BS. You know, he had this or that in his youth, blah, blah, blah. But it turned out that I had a severe vitamin B1 and B6 deficiency, and when I took these in high amounts, the tremor dissipated to a very significant degree, but I still had it. Well, anyway, when Sherry picked up my notes and started playing the sound, my tremor went away. If you notice, my head is shaking a little bit. I'm not usually aware of it, but once you become aware of it, you'll be noticing it. Well, anyway, that is one of the things that is sort of part of this. And when I would play the sound for 10, 15 minutes, all of that would go away. And in normal medicine, there is no treatment. You know, it's one of these things you learn to live with it, and there are many, many problems in medicine of a functional nature where, well, you're told, listen, this is not going to kill you, just do the best you can, or they'll give you pills. For example, another form of tremor, but this is not the type I have, but it's Parkinson's disease. They shake even when they're not trying to do something. Intentional tremor is when you stretch out your hand, and you know, like if you put a piece of paper on my hand, you would see a tremor. Well, in Parkinson's, they're shaking at rest, you know. Well, to conditions like this, you know, usually you end up taking all sorts of drugs, and each drug, no matter what doctor you talk to, there are no safe drugs. Each drug carries a whole gamut of side effects, and you never know what side effects you're going to get when you take the particular drug. With Sherry's approach, frequently if you uncover the frequencies that are missing and supply them to the body, it will correct them. I'm sure you probably have interviewed Bob, who currently is a co-worker here with Sherry. He was involved in a severe accident on a motorcycle, and he was mangled, and they gave him very little hope to just being able to walk. And he used to be very active in sports. He was an excellent tennis player. Well, he's back to doing all that because the medical end of it, they reached the end of the rope. They thought he was lucky just to be able to move around, And now he's a totally normal human being. There's a physician I met here a couple years ago. I don't remember his name now, but I'm sure you probably put him on film. He had MS. He went to the Mayo Clinic, went to top institutions in the United States. They reached the end of the rope, and he knew that from the orthodox medical perspective, he was doomed. It was just a question of when his end would come. And he's now a totally normal, functioning human being, And I've seen with my own eyes some remarkable cases here. Personally, I've had my share of illnesses. I've been brushed with the other side already a couple of times. I've had open heart surgery and have diabetes. One of the things that Sherry helped me with, I was 2.5 years ago, I was discovered to have a very malignant form of cancer, which is a non-Hodgkin's lymphoma. In fact, that brought me as close to the other side as I ever want to be. Not that I'm afraid of going, but I'd like to hang around for a little while more. But anyway, when they excised the tumor, I chose not to follow the traditional approaches because most of the cancer treatments you end up rapidly departing, and they bring a whole series of other problems. Now, there are some types of cancer in which I'm not trying to knock down my own profession, but there is also a lot of stuff that is not, they just don't have the means of dealing with it adequately. Unfortunately, many of the treatments used in cancer kill the rest of your healthy body, and you maybe survive your cancer, but you die of complications. In fact, a friend of mine that I worked with had the same cancer as I had and chose to go the other way, no longer with us. But as you see, I'm still sitting here and still able to interact in a normal way. And
late May of this year, I was involved in a pretty bad car accident. A lady forgot to stop at the stop sign, crashed into us broadside. I had broke my ankle. I had very badly bruised up my hand. There was so much swelling that I could bend my hand, my little finger about this far. This is about all I could do. And that was one of the things we looked at, and Sherry said, do you want to make that better? And I said, well, sure, why not? And so when she did the voice print, she found which muscles were in stress, played the tone to relax that muscle, and it was amazing. Within 15 seconds, I could go ahead and close my fist normally. Stop the tone, it was back where it was.
Just coming down a little bit more. Not all the way though.
It takes about 2 minutes. Is it?
Oh wow.
Nice touch.
I'm not using any extra force on it, just
Is it, were you in pain?
yeah, it hurts. It hurts.
It still hurts now.
Yeah, I mean it's not awful. It's like a stiffness, and it's sore. It's not awful pain by any means, but if I try to force it down, it hurts, and that doesn't hurt at all. That's pretty amazing, isn't it? Look, it's touching now.
Yeah.
See that? Wow, that's it. Back down to normal. I think that's a keeper. I think I'll take that one. Look at that.
It was just unbelievable to watch, and I'm trying not to be realistic about it. Is this really happening? It's just hard to believe that actually did happen, but I was there, and it was just amazing just to see it. But that's the type of things that we've seen a lot with some of the bioacoustics. So some tremendous changes there, and you still scratch your head and go, why is this working? You know, it just boggles the mind just to see it happen.